Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome back to Research Perch from the Massage Therapy Foundation. I'm Michael Reynolds, Marketing Chair for the Foundation, and here as always with Nikki Monk and Ruth Werner. Nikki, how are you today?
Hey, doing well. Thanks, Michael.
Joining us from your office in Indianapolis, I see, as always. And Ruth, how's your day going?
Just great. Thanks, Michael. How are you?
Excellent. Thank you. So glad to have you both. As our listeners know, if you're watching or listening, we really appreciate that. We unpack articles from the International Journal of Therapeutic Massage and Bodywork, IJTMB for short, which is at ijtmb.org. So today's article is treatment of lateral knee pain using soft tissue mobilization in 4 female triathletes. This one sounds like a powerful article here. A lot of stuff here. So obviously a lot of our listeners I know are interested in content related to sports, to athletes. A lot of people I think are going to be interested in this one. So Nikki, I'm told that you are going to kick us off today with kind of setting the stage for the background of this particular article, right?
Yeah, so this is actually a case series. So it's a prospective case series. In other words, it was set up before they actually started doing measurements on it. And I'd like to point out that John Winslow is a physical therapist. He was the author and practitioner, and so he was doing this within his scope of practice. But he points out that only manual therapy was used, soft tissue mobilization. It's what they basically massage in physical therapy speak. And so it's very, very applicable to our audience and to our field. And he does a really nice job, as we'll see later on, in the description of the intervention that can be very easily replicated in massage therapy practice and within a massage therapy treatment, either by shortening it or what have you. But basically what he does is he has 4 female triathletes who were referred to him after already exhausting other physical therapy options, exercise, and ruling out some other conditions that could be causing these issues. And he did a really nice job of setting up some good measures. He was looking at everyday function, self-perceived change by using the global rating and change scale, also looking at hamstring flexibility or tightness, and the iliotibial band flexibility. And was also looking at how far they could run until they reached a point that pain was keeping them from running, and then he would assess pain at that point. So the intervention that he applied was 3 40-minute sessions for 3 weeks, or so 3 times a week. How did I just say that? 40-minute sessions.
3 times a week for 3 weeks.
Right, 3 times a week for 3 weeks. And like I said, a very detailed, specific protocol that we'll look at a little bit more. And overall, the results were really, really good. 3 out of the 4 athletes had really great outcomes, actually went back to pre-issue level, and those levels held. So he did a nice job, too, with doing a very clear pre-treatment assessment, and then after treatment, waited a little bit of time, did it again a week later after the last series of sessions. And then 4 weeks after that, did another call and just asked about the self-perceived change. So just did it over the phone, didn't do all the measurements and pieces. But the results did hold. They felt like they had done as much better as they could have possibly been. So really nice and successful.
And the one who did not get a good response ended up in surgery for a meniscus tear.
Yes, and she ultimately had a good response from that intervention. So, end of the story, everybody lived well. So, right. So, but
yeah, that's good. We like.
But I think what's really nice too is at the end of this, Dr. Winslow points out that more research is needed in this regard. That no randomized clinical trials have been done using soft tissue mobilization or massage therapy, but that it would be a viable option, especially when some of these other issues are ruled out. And it's something that isn't necessarily considered or thought of immediately. And while this is about triathletes, so people really at the top of their game, this would likely apply to a whole lot of other folks as well. I know that I am starting to feel some lateral knee pain. And while I do run some, I don't think many would consider me a runner. So,
Same boat, Nikki. I run maybe 3 times a week, and I run about 2 miles, and I'm good. Like that's.
oh, okay. Well, then I can be a runner too, because that's what I do.
I like to run sometimes, very short distances, occasionally. So yeah, and I love this particular. These are my favorite articles that we discuss. I mean, we can find practical applications in just about any of these episodes we've done, but this one is just so relevant, so practical, and so accessible. I mean, how many massage therapists have runners, athletes, triathletes in their offices on their tables that this work can directly apply to the work they do?
Right. Well, and or anybody who from either excessive exercise or changing up their exercise regime or just doing a little bit of a weekend warrior type piece are starting to feel these sorts of knee pains. And he also does a really nice job of selecting accessible measures that people can use in their everyday practice as well. And he does a great job of very explicitly describing them. There's great pictures that are included in the article that highlight how the positioning and how it works. So being able to take this article, anybody could, either in an education situation or in a practice setting, could take this and replicate it and learn pieces from it. It's great.
Fantastic.
Yeah, this is a great. Okay.
Yeah, go ahead.
This is a great teaching piece. It, as Nikki says, it's got some wonderful, easily applicable demonstrations of measurement tools. I really loved that part of his process was to really use the runners and their goals about being able to run without pain. So, it's great to get a sense of how flexible their hamstrings are, but really what the runner is interested in is how far, how is this going to impact her ability to train. The other thing I want to remind us is that these are all amateur athletes, and so they're just you next year, Nikki, when you're doing triathlon.
You're so funny, Ruth.
But they're not professional athletes. So certainly they're more fit than the typical person, but they're not the elite level athletes that you would see, leading in marathons or things like that.
Mm-hmm.
Nick, you used a term I'm not familiar with, or maybe I just have forgotten. You used the term case series. Could you define what a case series is?
Yes. So a case report or a case study tends to be or is looking at a single case, a single instance. But there are times when you have similar situations, and in this case, he possibly saw, okay, I get these kinds of folks in my practice. I'm going to watch X amount of folks who come into my practice with these issues and apply the same treatment protocol and do the same kind of measures. And then I'm going to look at it in an article together. Now, even with an N of 4, if you will, there's some variations with these folks. But there's still, you can't run statistics on this. It's still a descriptive type study. And so it's just I'm sorry, what?
If the sample size is too small.
Right. Yeah, there's not enough power here to do any kind of meaningful statistical analyses. So a case series is essentially several different case reports all squished into one.
Okay, that makes sense. I just want to make sure I kind of assumed that correctly. So
yeah.
Yeah. Well, like I said, this is a really good one. So the takeaway for me seems fairly obvious, but sometimes I just kind of wonder if I'm really understanding it correctly. So. Again, the takeaway for a massage therapist, what would you say? How can a massage therapist working on athletes or working on others that have this type of knee pain, how can they use articles like this or case series like this, maybe in perhaps marketing or helping their practice in a business sense? Any ideas?
Well, yeah, go ahead, Ruth.
Okay. Yeah. No, I have all kinds of ideas about this. If a listener is a massage therapist who's interested in building their business, focusing on an athletic community, this would be the kind of article, and it's, you could even take more than the abstract. You could take the whole thing because it's really very, very reader friendly and not particularly technical. And so this article could be an introduction to a running club, It could be an introduction to a PT clinic that focuses on people with athletic types of injuries. And if we're gonna sort of extrapolate from this, beyond good women athletes with lateral knee pain, his conclusion is really about, once you've ruled out a bunch of things that manual therapies can't touch, can't reach, like the meniscus tear, it's important to look at soft tissue restriction. And massage therapists are uniquely placed to be able to offer some expertise there. In many cases, more so than physical therapists. This man happened to be certified in manual therapies and has integrated that into his practice. A lot of PTs don't. I'm really pleased that he chose to publish with our journal, but I am hoping that his colleagues in physical therapy will look here as well, because this is a nice crossover link for us to use to create relationships with other providers.
Absolutely. Well, and I think it's also interesting to point out, too, that this 40-minute intervention was very much within the scope of PT manual therapy, in that it was only looking at the right leg of these ladies, and the full 40 minutes was spent. And he outlines, the first 10 minutes were doing this particular technique over and over. 10 minutes was doing this particular technique over and over. So the order in which and the progression of. But a massage therapist could certainly do this within this full protocol within an hour and a half session. So within a whole body work session, then could still do this 40-minute protocol on a leg with issue, or could pare it down, not do as much time on it perhaps, and still include it in a routine 60-minute session, as routine as a massage therapist session can be, because they're all unique.
They are all unique.
This seems like the kind of article that a massage therapist could kind of keep in their back pocket, so to speak. Print it out, hand out copies if they're presenting to groups of athletes, hand out individual copies to people that maybe they partner with in the medical community. Seems like a good information to share with others.
Mm-hmm. So. And I think that it would be really important for them to highlight too the similarities between massage therapy practice, especially in this case, and physical therapy. Because I could see somebody saying, "Oh, but this is physical therapy," and yes, the physical therapist did apply this, and it was done within a physical therapy scope of practice and office. And this particular protocol and treatment approach is very much within the purview of massage therapy as practiced by practitioners.
Fantastic. Thank you. Awesome discussion. Anything else that we haven't covered?
I'd like to speak a little bit, because from my position as an old school massage therapist who sort of came up in the world of looking at orthopedic injury, and I want to run through his list of things to rule out first. So I'm just going to read from his conclusions in the abstract. After ruling out common causes for lateral knee pain, such as lateral meniscus tear, lateral collateral ligament sprain, patellofemoral dysfunction, osteochondral injury, biceps femoris tendinitis, iliotibial band friction syndrome, or osteoarthritis, soft tissue restriction should then be considered a potential source of dysfunction. In some cases, soft tissue restriction is overlooked. Athletes go undiagnosed and are limited from sports participation. That's a big deal. But I want to add that, within that list are several things that some of us feel equipped to address. For instance, biceps femoris tendinitis, or, I certainly have seen some interesting discussions and controversy over the whole existence of iliotibial band friction syndrome. Patellofemoral dysfunction is sort of an umbrella term for things going wrong at the patellar attachment. Some of those are soft tissue dysfunctions, again, that can be addressed with manual therapies. So, his point here is, don't let athletes lose out on what they love to do because they're not getting a solid answer from people who don't specialize in soft tissue manipulation. If we can build great relationships with the care providers who injured athletes tend to seek out first, it's this kind of article that's going to really allow us to broaden our profile in that kind of setting.
I would agree, and of course, my mind always goes to the marketing side of things because that's what I do. And to me, I love the possibilities of business development with articles like these. This is real world application of an observation, I should say, of the effects of massage therapy in various situations and populations. So I get excited about the kind of marketing supplemental material that massage therapists can use in this context to help, like I said, add some credibility, add some, at least add to a conversation around how can massage therapy really be effective in certain situations. So I just love it from a business standpoint as well.
Yeah.
So that's where my head is to stay. So thank you both. I really appreciate it. It was a really good one. So thanks so much for sharing, some definitions and helping us understand what a case series is, which I don't think we've encountered yet, or maybe I just forgot.
I think this is the first one we've done on this.
So I'm glad we were able to define that. Thank you, Nikki, and thank you both for kind of digging into this article. And I hope it's really helped our audience of massage therapists in their practice. So again, thank you both. Thanks everyone for joining us today. If you're watching, thank you so much. We appreciate you subscribing to our blog. Look below, and if you want to click on the iTunes or the Stitcher link, you can also subscribe via audio to this podcast on your iOS device like an iPhone or an Android phone, and you can take us with you. You can take us with you in the car, at the gym, on a run, which is applicable to today's discussion, folding laundry, anything you want to be doing while you're listening to your iPhone or your Android device via headphones. You can take this podcast with you. So if you're listening, thanks so much. Keep on listening. You can always get more information on the MTF website. So quick end of year giving shout out. We're coming up to depending on when you listen to this podcast, if it's pretty close to when we released it, we're coming up on the end of the year. And we just want to remind you that programs like this are supported by donors like you. And it's very easy to donate to the Massage Therapy Foundation. So the programs like this and all the other programs from the foundation can continue. Go to massagetherapyfoundation.org and just click on donate. And there are lots of ways. Every amount is helpful. So we really appreciate that. So, and again, these articles are from the International Journal of Therapeutic Massage and Bodywork at ijtmb.org. We encourage you to click below and grab the full text of the article, or go to the website and search and find it there, and you'll find the abstract and the full article. So we encourage you to subscribe to the ijtmb.org website. So
absolutely.
Wow, that was a mouthful. Sorry, I got on my soapbox a little bit there, but we're finally wrapping up here. So thanks everyone who joined us and stuck with us. And thank you, Ruth and Nikki. Always a pleasure speaking with both of you. So thanks to our audience. We'll see you next time.
Bye-bye.
See you then.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.